When we talk about rehabilitation after an anterior cruciate ligament injury, one of the key aspects for regaining knee functionality is properly restoring the muscular synergy between the vastus medialis and the rectus femoris. In this guide, you will learn how to identify neuromuscular alterations after the injury, which tests to use with electromyography, and how to personalize treatment based on the data you obtain. By the way, if you want to start using electromyography with your ACL patients and improve your results starting today, you can contact us by clicking the link in the description. What is the expected synergy in a healthy knee? During knee extension movements such as a squat, a lunge, or an isometric extension, the most efficient neuromuscular pattern should be for the vastus medialis to activate more than the rectus femoris. Greater activation of the vastus medialis is essential because this muscle helps keep the patella aligned during movement. By pulling it slightly inward toward the medial side, it prevents it from shifting outward toward the lateral side, which is key to preventing imbalances in the extensor mechanism and reducing the risk of pain or injuries in the femoropatellar joint. However, the rectus femoris as a biarticular muscle tends to be more dominant in many patients if there is not good synergy. So, how do you assess the synergy between the vastus medialis and rectus femoris using electromyography? To objectively detect these alterations and personalize treatment, we suggest this step-by-step clinical protocol. Step 1. Measure the activation of both muscles. Use electromyography to record in microvolts the activation of the vastus medialis and rectus femoris during functional tasks. Step 2. Compare the healthy side to the affected side. Look for absolute differences in activation between muscles. Look for an alteration in the expected synergy. For example, if the rectus femoris activates more than the vastus medialis, look for hidden deficits during tasks that simulate daily life or sports activities. And now I'm going to recommend some tests so you can assess this synergy. The first is an isometric knee extension. The goal is to check whether during fourth generation the vastus medialis shows less activation than the rectus femoris on the injured side. What are the common results? Take a look at the graph. The right rectus femoris activates less than the right vastus medialis. Alteration. However, the right vastus medialis also activates less than the left vastus medialis. What's the diagnosis? An inhibition of the right vastus medialis. Second test, squat with progressive load. Objective, to assess the motor pattern during a functional movement. Common results look at the image. The right rectus femoris again activates more than the right vastus medialis, and both muscles are inhibited compared to the healthy side. The diagnosis, protection pattern with bilateral deficit on the affected side. Third movement, lunges with load. Objective, to analyze a more dynamic and demanding movement. Let's see again what the most common results are. Look at the graph. The right rectus femoris activates more than the right vastus medialis. Additionally, there is reduced activation in both muscles compared to the healthy side. Again, in the diagnosis, we have persistent inhibition during tasks with functional load. How should we intervene based on the results we've just seen? Once the alteration has been identified, you can design a treatment based on this pillar. Strength training, selective quadriceps exercises, both isometric and with partial support, etc. Unilateral and functional work. Lunges, step-ups, leg press with feedback. You can use biofeedback to improve re-education. Visualize the activation of the vastus medialis in real time to correct compensations or any dominance of the rectus femoris. You can teach the patient using feedback to feel the vastus working during each repetition. You can also make use of percutaneous neuromodulation or electrostimulation. Use complementary techniques to activate muscles that are inhibited, such as the vastus medialis or the rectus femoris. This will help you improve the cortical response and the muscle-brain connection. Therefore, assessing the synergy between the vastus medialis and the rectus femoris after an ACL injury is key for effective rehabilitation. It's not just about regaining strength in general, but about ensuring strength along with a correct and efficient motor pattern. Electromyography gives you information that you can't see with the naked eye. With it, you can detect hidden activation deficits, adjust the treatment from the very first session, and maximize every repetition in your re-education session. See you in the next post.